So how do microorganisms cause disease? Well, there's true pathogens, and true pathogens can cause disease even in the healthy. And then there's opportunistic pathogens that wait for an opportunity to cause an infection. Those opportunities include age, so the very young and the very old are more susceptible to infection. At the very young, they're initially developing their immune system. At the very old, they're starting to lose some of their immune cells. Genetic defects in immunity and acquired defects in immunity, like AIDS, or DeGeorge syndrome, or SIDS. Surgery and organ transplants. Underlying disease, such as cancer, liver malfunction, diabetes. Chemotherapy and immunosuppressive drugs. Physical and mental stress, and other infections. So all of these can increase the likelihood that someone's going to develop an infection. So what is a pathogen? Like we talked about earlier, a pathogen is a disease-causing microorganism. Pathogenicity has to do with the ability of a microorganism to cause disease. A microorganism that is highly pathogenic can cause infection in anybody. One that is not very pathogenic would only be able to cause infection in a few people that actually come in contact with the pathogen. True pathogens can cause infection in even healthy people, while opportunistic pathogens can only cause infection in people with a decreased immune system, or the very young, the very old, or one of those other things that I talked about on the previous slide. In other words, they wait for the opportunity to cause an infection. Communicable versus non-communicable diseases. So communicable can be spread from person to person in a community. Non-communicable cannot. So an example of a communicable disease would be the flu. If someone comes into our classroom and they have the flu and nobody else is vaccinated for the flu, then it's likely that other people can get the flu from that person. So that's a communicable disease. A non-communicable disease would be Lyme disease. So Lyme disease is spread by a bite of a tick. So because if a person has Lyme disease and you start to see the bullseye rash appear and everything, if that person coughs or touches someone or comes in contact with another person, they're not going to end up getting Lyme disease, because Lyme disease is transmitted by that type of tick, the deer tick, the Exotoxins species tick. So Lyme disease is a non-communicable disease. It cannot directly be spread from person to person. Virulence. Virulence is the severity of disease that's caused by the microorganism. So, for example, we have E. coli, and you can get your standard run-of-the-mill E. coli infection. Most E. coli infections are self-limited. You can take antibiotics to clear the infection. Causes diarrhea if it's an intestinal infection with E. coli. But there is a super virulent strain of E. coli known as E. coli 0157. And that strain is known as the enterohemorrhagic strain. It has the ability to eat holes through your intestine. It actually perforates your intestinal wall and then infiltrates other organs in your abdomen. And it can cause a slew of very severe symptoms that can eventually lead to death. So if you're infected with E. coli, it's a communicable disease. You can pass it from person to person. If you're infected with E. coli 0157, this is a highly virulent communicable disease. The virulence factor is the component of the microorganism that makes a person sick. So it's the component that causes the disease. A lot of bacteria are going to produce toxins, or there's endotoxins in the cell wall of the microorganism, or they produce something that is going to affect the health of the host, and that's how we know that it's an infection. So the component that the bacteria are producing, that our immune system is interacting with, and that's causing tissue damage, that is their virulence factor. So how does a microorganism become established? We're going to go through this again toward the end of the semester when I talk about viruses and how viruses make us sick. But this is how bacteria make us sick. So the three major steps would be they have to enter the host through a portal of entry, they have to attach to the host, and then they have to survive host defenses. So portal of entry. So there's a lot of different ways that microorganisms can enter into the body. Exogenous would come from outside of the body. And this is the most common. So exogenous infections, they come from outside of the body. So the pathogens were outside and now all of a sudden they're inside. Endogenous come from bacteria that are already in the patient. The best example of endogenous infections would be UTIs. So most UTIs are caused by the bacteria that's coming from that person's digestive tract and happens to get up inside of the urethra of that person. This is why UTIs are more common in women than in men, because the length between the anus and the end of the urethra, or the opening of the urethra, is shorter in a woman than it is in a man. So as the bacteria come out of the digestive tract, they can get into the urinary tract, and then that can eventually cause a UTI. So endogenous, the pathogen is already inside of the body, and it's just moving into a different site, a site that it normally wouldn't be found in. Exogenous comes from outside of the body. And then you can see the picture of all of the different portals of entry, so ways that bacteria would enter into the body. Sexually transmitted infections. Pathogens are transmitted by sexual means. They account for 4% of infections worldwide. There's about 13 million new cases in the United States each year, and Milwaukee has the #1 highest rates of reports for STDs in the world. So with chlamydia particularly, chlamydia infections are highest in the city of Milwaukee. So something to be proud of, Milwaukee. So looking at this table here, and this table is from a few years back, but trichomoniasis, 7.4 million new cases each year. Human papillomavirus, 6.2 million new cases each year. And then chlamydia is the bacterial. So trichomoniasis, we learned about that. That's a protozoan. Human papillomavirus, we'll talk more about once we get to viruses toward the end of the semester. But that one can cause cervical cancer. Chlamydia is the #1 highest cause of bacterial-related STDs in the world. And again, Milwaukee has the highest reported cases. So chlamydia is 2.8 million, and then it kind of goes down from there. Pathogens that infect during pregnancy and birth. So very few microorganisms can cross the placenta. The placenta is an exchange organ for nutrients and waste to be exchanged between the baby and the mother. So if you look at the inside of the uterus, so here's the cervix, and then you have this amniotic sac that surrounds the baby and protects the baby. Here is the placenta, and there's blood vessels that lead to the placenta and away from the placenta. And then the umbilical cord, those blood vessels go all the way through. Once the blood has been filtered through this placenta, the nutrients will go to the baby and the wastes will come back the umbilical cord and leave the placenta. Some microorganisms have the capability of passing through the placenta. Those microorganisms are known as torch complex infections. So torch are common infections of the fetus and neonate, toxoplasmosis, other diseases such as syphilis, Coxsackie virus, varicella zoster virus, AIDS, chlamydia, rubella, cytomegalovirus, and herpes simplex virus. So toxoplasmosis, we talked about Toxoplasma gondii, the reason why pregnant women should not clean the litter box. Syphilis is a spirochete. It's a spiral-shaped microorganism that can go straight through the placenta. Coxsackie virus causes hand, foot, and mouth disease. So not only can that affect the developing embryo, but it also causes insanely high fevers in the mother. So usually that leads to loss of the baby. Varicella zoster virus, AIDS. AIDS is one, usually fetuses do not get infected with AIDS. So although the virus can enter into the bloodstream of babies, babies are first developing their T cells, and HIV can only infect helper T cells. So the virus is floating around in the bloodstream, and the baby hasn't developed the type of cell that virus can infect yet. So without the target, the virus just floats around in the bloodstream. After the baby's born, if we know that the baby's mom was positive, we can treat the baby and prevent the baby from ever developing the disease. And that's pretty successful. So mothers that are HIV positive do have a pretty high success rate of giving birth to babies without HIV. And then chlamydia can definitely cause an infection there. Rubella in an adult just causes a rash and a fever, flu-like symptoms, and it goes away. But in a baby, it causes miscarriage. Cytomegalovirus, and then herpes simplex virus. So herpes can cause blindness and all sorts of bad things in the baby. The infectious dose. An infectious dose is the minimum number of microorganisms that are required in order to establish an infection. So with the infectious dose, you need a certain number of cells before you actually get sick. Like for the flu, for example, it's about 100,000 flu particles. So if you only get 2 flu particles coming into your nose, your immune system's going to wipe them out before they have a chance to establish an infection. But after you get like 100,000, then that's enough. Then that will be enough to give you the symptoms of the infection or to go on to develop that infection. There's microorganisms with different sized infectious doses, like Francisella tularensis. 10 cells can kill you within 4 hours. However, E. coli, you need about 1 million cells before you start to have an infection. So a smaller infectious dose means a more pathogenic microorganism. So once the microorganism has gotten inside of you and you receive the correct dosage of the microorganism, it has to go on to stick to you. If the microorganism cannot stick to your tissues, it won't cause tissue damage. They have to establish themselves inside of you by sticking to the surface of your cells. Some of these even get into your cells, and we'll talk about those with viruses a little bit later. But they have different mechanisms of sticking to you, and the most common are going to be fimbriae. We learned about those when we talked about bacteria, so those are the finger-like projections, kind of look like cilia, but these are more important for adherence. Capsules, those gel-like layers, that's how they can stick to you. And then viruses use spikes, which again we'll talk about once we get to viruses. This is a table of some common microorganisms and some of the ways that they adhere to your tissues. So now they got in you, they're sticking to you, but wait, your immune system is ready to eat them. So they have to find ways to prevent getting eaten by your immune system. So phagocytes are white blood cells that eat foreign materials, including pathogens. But pathogens have developed anti-phagocytic factors, which prevent phagocytosis or prevent lysosome fusion to prevent digestion. In other words, the microorganism has some type of way to prevent itself from getting eaten, or if the microorganism does get eaten, it has these little chemicals that will prevent a lysosome, which contains the digestive enzymes, from being able to digest it. So the microorganism gets inside of your white blood cell and just hangs out there. So once it survives your immune system, now it's going to actually cause the infection. So these are the virulence factors. They're structures, products, or capabilities that allow a pathogen to cause infection in the host. Adaptations that a microbe uses to invade and establish itself in a host. And they determine the degree of tissue damage that occurs. So exotoxins are released out of the cell. Endotoxins are a component of the cell wall. So exotoxins are pretty common. They're pumped out of the microorganism and they cause tissue damage. They stimulate your immune system and they can cause all sorts of problems. They can go out and cause fever and everything else. Endotoxins. Endotoxins, the best recognized endotoxin is the lipopolysaccharide of the gram-negative cell wall. So it's actually a component of the cell wall here. As your immune system starts to eat the gram-negative cells, it releases the endotoxin. And these endotoxins can then circulate in the bloodstream, leading to the development of fever, delirium, so they can have brain issues with these, and so forth. So exotoxins are pumped out of the cell. Endotoxins are actually a component of the cell wall. And once the endotoxins are released, they cause their damage.